Now, this week, The Point welcomes Ms. Chu Việt Nga, Program Advisor of HelpAge International in Vietnam. And since 2011, HelpAge has carried out nearly 40 projects nationwide to support and promote the role of the elderly in the Vietnamese society. So thank you, Ms. Nga, for joining us today.
Thank you for inviting me.
Yeah, so for the first question, we would like to ask you, how would you describe the current state of elderly care facilities in Vietnam, and what kind of demand can we expect in the years ahead?
When assessing the care needs of the older population, it's important to understand that the older people group is not a homogeneous group. The complexity of care needs differ vastly based on intrinsic capacity, living arrangements, and personal preferences. According to the National Statistics Office, the survey in 2021, around 6.32% of the older population are those who require intensive care needs. They need external support with basic daily living activities. However, the amount and also the accessibility of institutional care services in Vietnam is still limited. According to the Ministry of Health, by the end of 2024, only around 10,000 clients nationwide are currently using these services, both in public and private facilities. The reason for limited service uptake is due to restricted space, infrastructure, and admission criteria of the public facilities, and also the high cost of the private facilities.
Right, so we just spoke of expanding the facilities for elderly care. So in your opinion, how important are private facilities, private health care, to the expansion and the development of elderly care facilities in Vietnam?
So the private sector has an important complementary role. Public resources alone will not be sufficient to meet the growing care needs, and over-relying on family care will strain the family. Private providers can help expand the number and the diversity of the care services. They can also bring in innovation and investment in new models of care. However, it's important that private facilities are backed up by a strong regulatory framework and quality standards.
And we've mentioned, speaking of regulatory framework, we have Resolution 72, and the resolution did lays out several goals, so including building at least one geriatric hospital in each province, and strengthening links between medical and elderly care facilities, and encourage private sector participation. So how do you assess these task group that has been set out by the resolution?
So the 4 measures identified in the Resolution 72 are well chosen. For example, regarding the geriatrics hospital, currently Vietnam only had one national geriatric hospital. And according to the resolution, each province and centrally managed city will have at least one geriatric hospital or a general hospital with a geriatric department. So such expansion will bring specialized services to older patients, closer to older patients in the country. And at the same time, these geriatrics facilities can become hubs for research, innovation, and training, which will advance the progress of geriatrics medicines. Regarding strengthening the linkage between the health system and care facilities, this is equally important because currently care facilities are not authorized to provide medical services. So enhancing such a partnership will definitely meet this immediate need. Overall, the key is to implement the measures in a coordinated way so that they complement each other and contribute to building an integrated care system in Vietnam. Resolution 72 identifies older people as one of the priority groups in its body of text. And this is both timely and strategic given the context of population aging in Vietnam. I believe that with these guiding principles, Resolution 72 will contribute to a sustainable and well-rounded caring system for the aging population of Vietnam.
So we have just looked at countries like Japan, which have a lot of experience in geriatric healthcare and nursing homes. So what lessons can Vietnam draw from these international models for the near future?
I believe that one of the important lessons we can learn is the way they finance this model. So it's a public-private partnership where the government will provide initial support and, for example, with the allocating land and invest in initial infrastructure and then procure private service providers to provide care services within these facilities. In Vietnam, around 40% of the care cost of private facilities is due to initial investment and the renting of the land. So if we have the support from the government, more older people and families will be able to access private services. In addition, I believe that we can also learn from countries with similar socio-economic situation to Vietnam, for example, Thailand, where they built a very strong community-based network of volunteers. This is a balanced system where hospitals, community services, and families and older people work well together.
So what do you think are the key challenges Vietnam should be mindful of when it comes to implementing policies that would ensure both healthcare and living standards for the elderly?
So Vietnam faces several challenges. The first is the speed of aging. So our country is one of the fastest aging countries in the world, according to the World Bank. So we have much less time to prepare and to adapt to the demographic transition. Secondly, the resources are limited. Next, ageism and negative stereotypes about older people still persist, which can discourage public and private investment into this population.
Right, and given all those challenges, what recommendations or solution would you propose to help Vietnam move forward in this area?
I would recommend 4 sets of recommendations. Firstly, addressing ageism by reviewing policies and the implementation of these policies to remove any barriers that older people face in fully participating in life. Secondly, strengthening integrated care at the grassroots level, especially. Community health stations could become the hub for coordinating medical care and social support for older people, because for an older person, medical care and social care is intertwined and cannot be separated. Third, diversify care services in a way that is both comprehensive and cost-effectiveness. Self-care, community-based care and health promotion should still be the foundation. Fourth, we need to support families and older people, meaning promoting healthy aging and preventive care across the life course, and also equipping families with practical training materials and skills on aged care.
Well, thank you, Ms. Nga, for your time and your insights. Respecting and caring for the elderly is a long-standing Vietnamese tradition, and the elderly are a valuable asset to the nation. Resolution 72 of the Politburo sets the goal that by 2030, the average life expectancy will reach 75.5 years, with at least 68 years in good health. Strengthening geriatric healthcare capacity and mobilizing resources for elderly care facilities are key tasks for the coming year.